So you've been noticing a few changes in yourself lately. You've been a lot more easier to irritate, and your eyes are show a kind of swelling or look like they're bugging out. You shrug them off and just say maybe it's a lack of sleep. Come a few weeks later, you notice that these changes haven't gone away, and on top of that, you're feeling weak and fatigued, and you're just tired overall. Again, you chalk it off to sleep and proceed to go to bed. Come morning, however, you're feeling agitated and you're sweating a lot, despite the air conditioning being on high. You're not able to think straight, but somehow you manage to get somebody to come and help you. Before you know it, you're in the hospital. The symptoms I just described are symptoms that correlate with the disorder Graves' disease. This disease is caused by hypothyroidism, which is where the thyroid gland here in your neck is working a lot more than it needs to, or producing more hormones than it needs to. I myself didn't know what this was until I was diagnosed with it when I was younger, like around 9 or 10. And even then, I did not understand what that meant, given I was a small child, so I couldn't comprehend exactly these big words the doctors were telling me. So in this speech, I will be explaining thoroughly what the disease is about and what its causes are, what the symptoms of the disease are, and the treatments and diagnosis for this disease. First off, there are many factors that are included with Graves' disease. In hyperthyroidism, it's the overproduction of hormones in the thyroid gland in your neck, which can be seen here. This right here is how a normal thyroid should look like. It's not swollen, it's just a normal size, and it's producing a balance of hormones. Here in the middle is hyperthyroidism, which you can tell the thyroid gland is a lot more swollen than the rest compared to these two. And then another disease, hypothyroidism, which is the underproduction of hormones in the body. We will be focusing on Graves' disease or hyperthyroidism. The hormones that are produced in your thyroid gland are control how your body uses its energy. So if something is off with your thyroid, it can affect many vital organs in your body and many processes that happen later in life as well. If this disease is left untreated, many problems can be created by it, like a mishap in pregnancy, problems with your eyes, skin conditions, amongst many other things. Despite it being very common in a lot of people in the U.S., it's not talked about or known about a lot. According to the National Institute of Diabetes and Digestive and Kidney Diseases, 1 in every 200 people are affected by this disorder. Since Graves' disease is also an autoimmune disorder, which is where your immune system attacks an organ in your body or another part of your body, it can be another autoimmune disorder can be developed next to it, like diabetes type 1. An example is myself. I've been diagnosed with Graves' disease, and then a few months back, I was also diagnosed with diabetes. And after an explanation from my doctor, it was told that it is because both of them are autoimmune diseases that they developed hand in hand. Okay, so now there are many factors and symptoms in specific age groups that this disease or disorder attacks. Some symptoms are weight loss, increased appetite, a faster heart rate, higher blood pressure, and increased nervousness, and as well as sensitivity to heat, eye sensitivity towards like sun, and there could be a change in frequency or total cessation of menstrual periods, as well as stated before, mishaps in pregnancy. This disease can be found in all sorts of people. However, certain people are at higher risk to develop this disorder. Women are most likely to get it than men, and people between the ages of 30 and 50 are more likely to get it as well. Though it can be developed in a wide range, from a young age to an old age. Because Graves' disease is an autoimmune disorder, once again, people with immune disorders can develop Graves' disease in their disorder, along with their disorders. The cause for this disease isn't exactly known. There isn't a lot to know. There isn't much we do know, or experts that do know why the immune system attacks these organs in our body. However, there are a wide variety of treatments for this disorder, like beta blockers, antithyroid medications, radiation therapy, and surgery. I myself had radiation therapy. I took a pill that killed off the gland, and while it's still there, it's not producing any hormones anymore. Now I'm taking a pill that produces the hormones itself. This disorder can be diagnosed with radioactive iodine uptake testing or a thyroid scan. Consequently, in conclusion, Graves' disease can lead to complications and many symptoms. Very, very harmful symptoms. And well, thankfully though, some treatments can help this disorder, and there are many, many diagnoses to help the process go quicker.